Throughout our 4-year program at Deakin, we have 4 themes that run longitudinally across all of the years. We have the largest theme initially, medical science and clinical practice. Kellie's the clinical practice theme leader here with us today, which really looks at the biological and the behavioural sciences underpinning the practice of medicine and also clinical skills that are responsible for effective person-centred healthcare practice. And the clinical skills training really does begin from pretty much week 1 of year 1. And we're really fortunate to have clinical skills vertically integrated through our course. And you'll hear more about that from Kellie. We have Indigenous health as a very strong theme through our year 1 to year 4 program. And we really look at addressing social, political, environmental, and economic determinants of Indigenous health in both clinical management, community development, and also cultural safety. We have our public health medicine or PHM theme, which is looking at healthcare from a community and societal perspective, encompassing epidemiology, population health, health systems, and ways in which healthcare practitioners can support better health outcomes from the individual through to the big global scale. And I'm sure everyone's a lot more aware of public health since the COVID pandemic. We also have the ethics, law, and professionalism theme, or ELP as we call it, which looks at the foundational and applied concepts required for the ethical basis of health, the social and legal frameworks of medicine, and also the professional requirements for practicing medicine. In our medical course, we have our themes. We also have a research scholar program that you will come to know mainly in years 3 and 4 of the course, where you will actually learn research skills to take you up to a master's level degree, which you will exit with, and you will have the opportunity to work with some really skilled researchers in writing a research proposal and doing a literature review. We really think about collaborators and leaders in our graduates. This is your journey. You are becoming a medical doctor, and there are some steps on the way that we will guide you through. You will graduate as a medical expert, a health advocate, and scholar, and you will actively manage your own health and well-being and attend to your own lifelong learning in the service of others. You also learn to work respectfully as part of teams to provide safe, culturally capable, ethical, and evidence-based care for patients and communities as both a professional and a skilled communicator. The course structure, we have a 4-year-long program. The first 2 years are largely campus-based, and the last 2 years are based pretty much 100% of the time in clinical placement, based in health services, which are hospitals or general practices scattered throughout the state of Victoria. In the first 2 years, you will learn in semesters. First semester, HME 911, you'll study an introduction to the body and human biology, and then move on to infection, defence, and repair. When you come to the second semester, you'll start learning more around body systems, and you'll learn cardiovascular and respiratory, renal and gastrointestinal, and then you'll move into year 2, where you'll learn about the metabolism and musculoskeletal system, as well as the endocrine system and, cradle to grave type physiology and the practice of medicine. As you move into your final semester on campus, you will study brain and behaviour and then have a skills consolidation block, which will enable you to get ready to enter the clinical training environment. And that block is called TCP, or Transition to Clinical Practice. In year 3, you will undertake rotations of 7 weeks each in medicine. There'll be 2 medicine rotations. This is internal medicine, general surgery, orthopedic surgery, urology, plastic surgery for 2 7-week rotations. Then you'll move through children's health for 7 weeks and obstetrics and gynecology for 7 weeks as well. If you are allocated to our rural community clinical school, you will learn in an integrated fashion across the year, but you will cover all of the rotations I've just spoken about. In year 4, You'll have 5-week rotations in general practice, family medicine, emergency medicine, anaesthetics and intensive care, aged care, rehabilitation and palliative care, mental health, and you'll have 2 pre-internship rotations, which are designed to get you ready for being a junior doctor and actually graduating. And I think it's also important to note that the second pre-internship rotation for our international students can be undertaken back in your home country in case you wish to exercise that right to return home if you were considering becoming a junior doctor in your country. And there's also a 5-week rotation in the Research Scholar Program where you will undertake remote learning, and that culminates in a research conference presentation where you present your own work and you get to listen to the work of your peers being presented as well. And then you graduate 4 years after starting our course, which is a great cause for celebration, and we're very happy. I'm still talking about this. Kellie, correct me if I'm handing over to you. Year 1 and 2, the first 2 years are based at our Geelong Warn Ponds campus for general entry stream students, and we have smaller cohorts of 15 students each at our Ararat and Warrnambool campuses for our rural training stream students. Students are really fortunate to learn in purpose-built learning environments where we have simulated clinical rooms that look like hospital wards and dedicated medical teaching spaces where you can break out into small groups for study and also to undertake problem-based learning. I've talked a little bit about the blocks that you'll study in year 1 and 2, where you'll focus, say, on the cardiovascular system, but you will draw on learning from all of our themes integrated. So medical sciences, clinical practice, etc., will integrate in that block within that semester of your learning. We run quite a few small group learning groups, one of them being problem-based learning, but another group being clinical skills, small group learning that Kellie will talk about. And also we have supporting tutorials, lectures, and anatomy and pathology workshops. You will also undertake communication and clinical skills training, and you'll have the opportunity to go on some placements right from year 1 of the course, which is really important. Year 3 and 4 will be undertaken at one of our clinical schools. And I'll pass over to Kellie.
Okay, I think I now have control of the slides. So thank you for having me, everybody, and a warm welcome to this evening. So clinical skills, what do we teach in clinical practice and clinical skills? So we talk about all the, if you like, the doctor things that we do. So we teach you and we scaffold you across those first couple of years around how to perform a clinical interview, how to communicate with the patients and their families. We often use simulated patients, or we may use volunteer patients for you to get practice in this space. We use a lot of clinical cases in our clinical teaching, and you can then take those cases away and practice with those outside of the timetable teaching periods. We also do a lot of procedural skills. So for example, learning how to take blood, learning how to do an ECG, learning how to take a blood pressure. And as you can see from a couple of these slides here, we also do some work in eyes and ears. So learning to have a look in the eye, looking in the ears, seeing what you can see, what is normal, what's abnormal. We also do some physical examination skills. So learning to look at people's joints, having a listen to their heart and lungs. And what underpins all of that is communication. So we teach you communication skills. So when you're clinical interviewing, we teach you techniques of how to ask questions and gather that information that you need to work with your patient or their carers to give them the best plan of management. When you're doing your physical examinations, it's really important that you consent and you communicate with your patients about what you're doing, and then also presenting your findings to somebody else, and also in procedural skills. So lots of communication all the way through. We actually run a couple of purpose workshops just so that you can practice those skills alone outside of teaching, so you can be really focused on your comm skills. Now let's see if I can move this along. Don't think I can get the slide to go. Oh, there we go. Terrific. The next slide is all about clinical placements, and Claudia will probably talk a little bit more about this too, as we work together to provide clinical placements for all our students. So we send you to a variety of different places. So it might be an aged care placement where you will see how teams interact, how the elderly are cared for. It's really great. A lot of our elderly patients in aged care are really keen to see medical students and they want to tell their stories. So you can practice some of those communication skills that you've learned and, try taking a history. We also have a medical imaging placement, and you do that in first and second year. We have a medical imaging provider in one of our large university hospitals here. So all students get to rotate through that. We do some community care and allied health. So it's important, healthcare is part of a team. It's not just doctors and patients. It's doctors, it's nurses, it's physios, it's social workers, dietitians, podiatrists, people that actually work in community hubs. So we all want to get together and provide the patient with the best outcome. So giving you exposure and experience in those clinical placements is really important so you have an understanding about how to refer to them and how to work together as a team. Specialist clinics are also on our list. So I'll give you an example. You might attend a respiratory physician's lung function test, or you might go to a cardiology placement where you can see them doing ultrasounds of the heart. So there are some specialist placements, and most recently, we're actually exploring refugee health. There is a refugee clinic here in Geelong. So hopefully that becomes a clinical placement in the future. And I really wanted to hone in on general practice. So general practice placements, every student at Deakin gets to go to a general practice placement. If you go into the RTS program, there are multiple general practice clinical placements in second year. So we've got a lot of relationships in that space. And so you get to see patients in a different light. Rather than just being acutely unwell in a hospital, you can see how they present in general practice. So this is just another slide about year 3 and year 4, which Karen touched on before. You have blocks, so the medicine, surgery, obstetrics, gynecology and children's health block in year 3. And then in year 4, we have mental health, anaesthetics, intensive care, general practice, aged care, rehabilitation, palliative care, and also emergency medicine. But as you can see by the circles around the outside of these actual blocks, there's lots of other work that goes into it. So lots of people are part of your medical student journey, so that you can have lots of background information to be able to look after patients, for example, in medicine. So it's really important that you have an understanding of how pathology happens or what pathology you need to look after your medical patient. You need to do imaging. Are there other factors that influence this patient's care? Are there public health issues? Are there ethical issues? We also do a lot of work in prescribing as well. So we think that that's really important around patient safety. So we start teaching you about prescribing and medications right from the get-go in year 1, and you'll be scaffolded with that information all the way through year 2, year 3, and year 4. And we obviously Indigenous health, really, really important to us. And we like to put that right again from year 1 all the way through to year 4. So there'll be a number of patients that you may meet in the cases that come from an Indigenous health background. We talk about culturally safe communication with our Indigenous health patients. So we actually have sessions targeted specifically to that, so we can put tools in your tool bag so you do feel safe, you do feel confident, and you've got the language skills that we need to be able to communicate effectively and safely. This is just a map to tell you where we actually are. So in the big map of Australia, we sit on the south eastern coast. Our clinical schools are predominantly based in the lower half of Victoria. Eastern Health Clinical School is what we call our metropolitan clinical school. So that sort of sits about 20 kilometres from the actual city of Melbourne. It's very easily reached by public transport. It's got a train station that runs from the city of Melbourne out to Box Hill. and then some of our other campuses that are attached to Eastern Health, really good bus lines and public transport trains to get there. Geelong is situated right on the corner here of what we call our Port Phillip Bay. So we're actually on the coast, we're on the water. And again, there is direct train service from the city out to Geelong. Ballarat Clinical School, which is also now known as the Grampians Clinical School, is about an hour north of Geelong, and there is a bus service that goes up to Ballarat. And Warrnambool Clinical School is approximately 2 hours west of Geelong, and again, bus lines and train service that actually come all the way from Melbourne via Geelong out to Warrnambool. So lots of access to these sites. And what I think is really good is that they're actually not too far away from each other. So a number of the staff actually cross over in these places. So you'll get to meet a number of staff across the way. The Rural Community Clinical School is our 5th school, and that is currently based in what we call our southwestern region. So we sort of have a set of mountains that are called the Grampians. So the Grampians region is sort of north of the Grampians. We have a number of clinical sites. So the Rural Community Clinical School are smaller hubs of teaching, and what you do is you're actually attached to one of the local health services and the local GP practices. So as you can see on the map, there's about 6 hubs in the Grampians region. And then we have the southwestern region, which sort of runs more along the coastline, so south of the Grampians. And there's 4 or 5 sites in that space as well. Those particular groups of students, they are obviously in those spaces during their everyday teaching weeks. However, they cluster together on several times during the year, 6 or 7 times, where we have intensive teaching sessions. And it's really lovely that all the students can come back together and work together and meet some of their other colleagues at Ballarat, Warrnambool and Geelong. I think that's all I have to chat about. So look forward to the questions a little bit later. So thanks for having me.
Thanks so much, Kellie. One of the focuses of our course is actually on general practice and providing generalist care in communities and to communities. So if you're interested particularly in that stream of care, we have a general practice rotation in the last year of the course. We also have a longitudinal primary and community care program that runs throughout year 3, where you'll get to have different visits with a general practitioner and follow patients longitudinally as they transition from tertiary care through to primary care settings. And those 2 programs run in place for all of our medical students. We also focus on how healthcare is managed in the general community and what is the patient's experience of healthcare in these different settings and how we can best work together to manage chronic illness, particularly in delivering team-based care.